Hello, my name's Anthony. I'm a patient of Dr. Mahesh at Mediclinic City Hospital. I came to Mediclinic City Hospital, largely on recommendation. Everyone said very, very positive things, so it's never really a decision. It was always very much a full concluded kind of decision on the onset. Originally, my symptoms related to my urination, so I knew it was urological. My symptoms were very slow urination, general pain and discomfort whilst urinating. I also had disrupted sleep because of the discomfort and the pain and very, very frequent urination. It was getting to a point where it was having an impact on my general quality of life. So I had contact with the general practitioner in the UK, the NHS. There was no real diagnosis. Only really received the diagnosis on the diverticulum bladder when I met with Dr. Mahesh, and it was a very quick and prompt diagnosis, at which point that was escalated to an operational procedure, where fortunately everything was very quickly corrected. It was a good procedure and I recovered very, very quickly. My operation was on Friday, 25th of August. The following day, I was already up, mobile, largely pain-free, walking around the ward. Prior to the procedure, I had a series of consultations with Dr. Mahesh. All of the questions and the concerns which I had were promptly answered. The overall experience was excellent. The nursing staff were great. I got to know them well, particularly Mark, who was there every morning assisting my recovery. The catering services, the rooms, they're all good. It feels very much like a hotel service at Mediclinic City Hospital. Absolutely would recommend Dr. Mahesh.
I saw Anthony because he was referred to me by a colleague, Dr. Farhad, who is also a consultant urologist at Mediclinic City Hospital. Anthony had a bladder diverticulum, which is literally an outpouching of the lining of the bladder through the bladder muscle. I discussed this in detail with Anthony and also spoke about the options for treatment. Conventionally, one would undergo open surgery to remove the diverticulum and to close the defect in the bladder. The other options are laparoscopic surgery and robotic surgery. And Anthony and I discussed the option of having robotic surgery, which he agreed to. The procedure was performed with literally 4 to 5 tiny incisions in the abdominal wall. His recovery was really very quick. Pretty much overnight, his symptoms that he presented with originally had disappeared. The thing with robotic surgery is that it gives the operator a magnified, 3-dimensional, high-definition view of the inside of wherever we're operating, and it makes it more accurate, less bleeding, and essentially quite pain-free. Bladder diverticulums are not that common. In Anthony's particular case, we believe that this was something that he was born with, which got worse over a period of time. Usually men who have bladder diverticuli have it because of enlarged prostates or some sort of obstruction from the bladder to the outside. In Anthony's case, none of this was present, so therefore we believe that this was most likely a congenital thing that he was born with, and the incidence is rather rare because only 1.7% of people have a bladder diverticulum that they're born with.